Hi, good morning. Happy Wednesday. Welcome to today's webinar entitled The Mental Health Connection for Leaders. The purpose of the presentation today is to help you care for yourself and care for others. This free webinar is brought to you by UHA Health Insurance, Hawaii Health at Work Alliance, Hawaii Employers Council, and Hawaii Business Magazine. My name is Sherry Clark, and I'm the Chief Operating Officer for Hawaii Employers Council. Today's webinar is scheduled to last 1.5 hours and will end at 12:30 p.m. A copy of today's handouts, along with a recording of the presentation, will be emailed to you after the event concludes. The handouts are also available for you to download on the GoToMeeting panel, which you will see in the handout section. Questions are welcome. They may be asked at the end of the webinar if time permits. So please feel free to type in your questions in the question panel for the GoToWebinar panel, and I will ask the questions on your behalf at the end of the webinar if there's time. And we'll get through as many questions as we can. So the agenda today is we have 3 dynamic speakers who will be speaking to you. Heather Pierucki will kick off the presentation today, spending about 35-40 minutes discussing how to notice when employees may not be at their best, how to approach those conversations, and how to develop action plans with our teams to support and encourage each other. Following Heather is Dr. Kathleen Kozak, and she will highlight how preventative mental health service can help individuals and address the topic from a clinical point of view. And finally, Mike Story will conclude the presentation by sharing mental wellness best practices for your workforce that are actionable, effective, and easy to integrate and initiate in your own wellness programs in your own office. So at this time, I'd like to introduce Heather to you. Heather is a therapist, clinical consultant, and managing partner of ChangeWorks. ChangeWorks is an organization that focuses on supporting agencies in working with the population serving individuals managing mental illness, substance abuse, houselessness, and poverty. She's experienced in working with adults diagnosed with severe and persistent mental illness, children and adults with developmental disorders, and alcohol drug treatment in both residential and outpatient settings. You know, I consider Heather to be a personal friend of mine since we met several years ago in a cohort that introduced us to the Aloha response. So it is my pleasure to introduce you to Heather. Heather, thank you for joining us this morning. I will hand the forum over to you.
Awesome. Thank you, Sherry, for that wonderful introduction. We're going to make sure the presentation comes up as it needs to. So today, first of all, it's absolutely a pleasure to join all of you and talk about this topic. It's one of my favorite things to present about, converse about, argue with my friends about. Wellness and self-care is something that we sort of talk about in like buzz terms, or you know we need to do it, but we're not super great at it. I think that part of the reason that I love talking about this so much is the more that we talk about it, the more we will start to set intentions to actually do something about it. And if there's anything that I've learned in the last 6 months, it's that if I don't dedicate time to my own wellness practice, I can't really expect that anyone is going to do that for me. And so I think, you know, ultimately, the first thing that I want to talk to you guys about is setting the intentions for today. Anytime we have a presentation, anytime we have a discussion around something that we're trying to change about our day-to-day, we want to start with setting the intention to focus on how we are feeling, focusing on ourselves first and foremost, and then looking at the tasks that we're obligated to complete, and then really looking at the potential impacts for our community at large, whether that's your team, whether that's your set of clients or consumers or members, and whether that's the huge community that you exist in, you live in at your city or county or state level. It's especially true that managers and executives, with all the busyness of their day-to-day, really set aside time to focus on what their wellness practice looks like and what it looks like to pay attention to the people that they manage. And, you know, at the end of the day, if we don't set that model, our teams can't be expected to follow it. And so, especially with COVID and this, discussion of global pandemic and the ongoing challenges of our local community and our state community and our nation, and even, our world to some extent, we're really in the midst of figuring out what it looks like to do today, tomorrow, and the next day. And so today I would encourage you just to be very present, try to hold space with us, and try to help us navigate through the who, what, where, when, wow, and what the heck. And I wanted to share quickly with you a paragraph from my friend Sarah. When COVID first started, and Sherry mentioned an Aloha cohort, we got together and brainstormed about how we could support our local community the best. And what she sent was kind of a brain dump, but it starts with, what if the workplace was a place of connection? What if it was a place where it made our relationships better and it improved us as humans? And day to day, day after day, we were able to deliver a greater impact outside of ourselves because of the deep, trustworthy relationships that we have with each other, the connections that we lean into, and the authenticity that we share. What if we outdated hierarchies and we got rid of manufacturing models and we replaced that with enabled and empowered thinkers to be able to quickly solve problems and collaborate freely? So what you can expect from today is kind of a refreshed definition of wellness, burnout, and what we consider balance. Those of you that have either had a conversation with me or know my philosophy know that I believe in balance, but I do think that the idea of 50-50 balance is pretty unrealistic. 3 ways to approach being well on our own: ways to recognize burnout, exhaustion, withdrawal of our teams and our partners, and then ultimately how to connect and engage with each other in a simple but effective way. So when we define wellness, if you sort of Google it and you say, hey, well is this state of being in good health, or well is this feeling of being okay. One of the things that struck me the most about the research was that wellness is actually an actively pursued goal. Everything that I read talked about how if we don't set the intention and do it with purpose, we probably won't get to a point where wellness becomes so habitual that it's ingrained in our day-to-day. Talked a lot about kind of 7 dimensions of wellness. You have your physical wellness, so how well you are with moving your body; social wellness, how healthy are your relationships; emotional wellness, how healthy are you in your relationship with yourself; spiritual wellness, which is a broad spectrum that we just do not have enough time to talk about today; environmental wellness, which is, how healthy is the air and the, lifestyle that your community lives; occupational wellness, so how well are you at work; and then your intellectual wellness, how do you feed your brain? And so if we think about all 7 of those dimensions at once, it becomes super, super overwhelming. So what we want to do is create an active process of making choices toward a healthy and fulfilling life. The dynamic process of change and growth is not something that you just snap your fingers and develop. It's not just an absence of feeling bad or feeling diseased or feeling unwell. It really is this intentional, dedicated pursuit to being well and finding our own wellness. So, I mentioned in the beginning that we have to start with ourselves. A couple of weeks ago, my husband went into the hospital and ended up having a slightly emergency surgery. He's fine now, but it was really scary to me because I realized that my full-time work plus my volunteer work plus my caretaker duties became too much for me. And so my workplace, or my home right now, became this very, very stressful, overwhelming place. And so I got to the point where I finally had to sit down and say, okay, I'm experiencing some burnout and I need to take a step back from what I'm doing because my focuses need to change. So when we think about our workplace, especially in the times of COVID, we have to be really, really careful to understand how all of the dynamics of our workplace play into each other. So if you're at home, you got kids, pets, obligations, the plumber has to come because you have a leak, the landscaper needs work, so he wants to come to your house and it's just like an overwhelming sense of physical and emotional exhaustion. And in the workplace especially, we define burnout as this sort of special type of stress, this physical, emotional, environmental exhaustion that is catapulted and made even heavier by a sense of reduced accomplishment and really a loss of personal identity. Many of us really take seriously our work, and we find a lot of identity in the work that we do day to day. And so we want to be really, really aware of how we feel physically, but also how we're feeling emotionally in terms of our own ability to decide whether or not we've lost a little bit of the identity that we ascribe to in our day to day. And so when we talk about balance, and I've created probably a little bit of controversy about this idea that I think balance is kind of a silly idea, it really isn't about doing things differently with your time. Balance isn't as easy as I'm going to spend 8 hours working and I'm going to spend 8 hours not working. It really is this idea of better managing your boundaries. When I was working in an executive leadership position for a nonprofit, I probably worked between 50 and 60 hours a week every single week. It didn't necessarily mean I was in the office for 50 to 60 hours a week, but I was constantly doing things that were tied up in whatever the mission of my work was. And so I had to, as I transitioned into self-employment, I had to understand that better boundary management for me, better obligation management for me meant not working 50 to 60 hours a week, because I had to become a better professional in the work that I was doing with a greater balance of less outside pressures. So my challenge today is really that balance isn't something that you like wait until you find it. It really is something that you sit down and you create with yourself and with your team and with your workplace. When I was a teenager, my dad, oh, this was such a frustrating conversation for me, but now I sort of realize why he was so insistent about this. But, you know, I wanted to work and I wanted to do extracurricular activities and I wanted to do really well in school. And he came to me and he said, you need to prioritize something that you really love. Because if you make everything a priority and everything gets your time, you end up bringing half of yourself or a quarter of yourself to all of those things. And so when you prioritize something and you decide to give something your all, make sure you choose that wisely and you allow the other things to take up less of the time and less of your brain space. When you prioritize, you need to make a really dedicated effort towards that one thing or those two things. So you guys have a handout. I'm not going to explain this super in depth, but when you are looking at whether or not your existing commitments are a priority, this graphic is actually super helpful. So high priority things and a high amount of time that you spend on them, those things probably need to get the majority of your prioritization, whether that's in time or brain space. Things that you waste time doing that aren't beneficial for your mental health, your emotional wellness, your workplace obligations, probably need to spend less time on those things. So the first thought challenge that I want to present to you guys, just in terms of this very short presentation, is when you think about implementing change into your day-to-day and you think about developing a wellness plan for yourself, consider these questions. What might help me move through this challenge more efficiently, or even in some ways effectively? If I'm going to add a half an hour a day to move my body because I don't feel like my physical wellness is on par, what would help me do that? Is it a partner to help keep me accountable? Is it a membership so that I have an obligation to go somewhere? What might help me move through this challenge or this change? And then second, how can I change to implement this change process? So sticking with the physical wellness, if I'm going to add a workout routine into my day-to-day, how might I change my perspective in order to implement that change? So maybe it's when you wake up not thinking, oh God, I don't want to move my body today, rather thinking, oh my gosh, I get to move my body. I get to go outside, and maybe I have to walk around the park and I can't walk in the park right now, but I can spend a half an hour getting some sunshine, moving my legs, getting my blood flowing, and really start to prepare for my day. Third and fourth, who else is required and what needs to be in place? What do I need to do in order to make this change happen or to start building this habit? And so as you start to look at things that maybe your team needs to do differently or you need to do differently, these questions will help you get started with building that habit. So now that we have a little bit of a refreshed idea of what wellness means, and we understand that there are many dimensions of wellness and we cannot focus on all of them at once, what does it look like to move beyond it? Well, I consider kind of 4 things. One is be responsible. If you're setting up yourself for success, be responsible to the decision that you've made. In sticking with the physical wellness, if you're working from home and you want to be responsible, but you want to add a 45-minute walk in the morning, set yourself up for success by communicating with your team. Hey team, I know we start at 8. I'm going to hop on right at 8 o'clock and I won't be available from 7 to 8 because I am prioritizing my workout routine and I'm going to go for a walk every morning. Over communicate with people so that they know what to expect from you. And in the same breath, be responsive when they ask questions. Oh my gosh, you know what? I'm totally going to be accountable and I'm going to go for a walk every morning too. I'm going to take my kids and my dog with me because they could use a little bit of sunshine too. If you're laid off or you're furloughed, take a few steps each day to check in on whatever you're responsible to, whether that's your union, whether that's unemployment, whether that's creating a routine that helps keep you as stable as possible. Do those things. And, even if you don't feel like it, or even if you're really fatigued by it, create and carve out that time in your day to be responsible. Especially as an essential worker, I understand that everything feels like a crisis right now. It's very, very difficult and challenging to show up every day when you're in any sort of healthcare setting. Crisis and emergency workers take extra time to check in with your teams. If you think you're doing that already, double the time that you're doing that. Even if your staff says, yeah, I'm good, make sure that you are checking in with them and using your teammates and your leadership to be able to lean on. Second, be respectful. Not everybody's going to handle COVID the way that you might handle COVID. So even if you're going to work every day, things aren't going to be the same for you, but things also aren't going to be the same for your community. So people who are home during the day may text you more often, or they may email you more funny stories, or they may ask if you want to blow off work and go for a walk. Those are all things that we need to be able to clearly communicate with each other. Hey, listen, I'm in a super new and weird version of what my day-to-day looks like. I know it's temporary, but I need you to respect my space and my boundaries and the expectations that I have for myself. And so in the same breath, let's make sure that we're exercising extra compassion for each other. This is not a time in which we need to be really, really hard on ourselves, or we need to try and implement some crazy new routine because we have free time on our hands. This is not the time to be adding 6 hobbies if you're working full-time from home and managing your children's online schooling and taking your pets to the vet. Be aware and be understanding of what you're experiencing so that you can understand how you might be influencing everybody else as well. This is especially true for our leaders. We may think that we're doing okay, but it is our responsibility as the leaders of our teams to be extra respectful to the people who are doing the work with us. We need to be extra compassionate towards them and whatever it is that they're dealing with outside of work. Because if you remember the paragraph that I read in the very beginning, what if our workplace was a place where we connected more, where there didn't need to be a hard line between personal life and professional life, where those two things could bleed into each other. Be reputable, stand true to your word, be reliable, be accountable. When you say you're going to do something, follow through on it. Let someone know if you can't do that. If you've had enough and you're exasperated and you're tired and you're exhausted and you see those signs of burnout, be open and talk to your leadership. If your direct supervisor isn't understanding and compassionate, exercise your right to talk to other leaders in your organization. Honor the guidance that they offer to you. Sometimes it's super difficult for us to sort of look in the mirror and be honest with ourselves about when we're feeling really badly. And so if we've gotten to the point of burnout and we're going to our leaders and our leaders don't feel compassionate, seek to find that in whatever way that you can within, the obligations of your workplace. Knowing yourself is really an incredible gift. So spend a few minutes each day saying, hey, I'm doing a good job. And then be resilient. Resilience is something that has been thrown around a lot lately because we just have to kind of tough it out. But the truth is, as much as this is temporary, it feels very, very heavy. And while we know logically that we're going to get through this and that we're stronger together, it's really hard to do it. And so resiliency isn't about always knowing the right answer or always showing up. Sometimes resiliency is, hey, listen, I need to take an hour off today because I got to take a break. I'm feeling burnt out. And, setting up yourself and your communication styles with your leadership and your teams is extra important now, so that they can understand when you are going through something that's really difficult. So we talked about some of these things already, but creating routine, especially for leadership, can help make your days feel a lot less chaotic. When I worked at the nonprofit, our CEO had a do not disturb 4-hour block every single week. And that was the time that she took to arrange her week and to make sure that she had time to be present for team meetings, make sure that she had time to be out in the community back when that was more open, to be able to attend meetings that, increased our exposure, things like that. And that really helped her set herself up for success. And I've adopted some of that, as I've moved into self-employment, because self-employment, the lines are totally blurred. You're always working, but you're never working all at the same time. So, as leaders in our community, we need to lean on each other, and we need to learn from each other, and we need to be there for each other so that we can support each other and make sure that our emotional wellness is on point. So, in the grand scheme of things and, the larger picture, let's make sure that we're realistic about what we can do. Are you able to check in with all 15 of your team members every single day? I don't know. It depends on what check-in looks like. And, I loved checking in with my team because I'm super relational, but often what happened was my administrative tasks suffered, and it became a contest. Do I check in with them? Do I do my admin tasks? And so what I did was I created a text stream with our group, and I said, hey, this is your morning check-in. Here's a quote that I found. If any of you have anything that you want to talk about, want to discuss, anything that's getting in your way, send a text back and we'll set something up. And most of the time the team was okay on their own and with each other. But when they did have things, we were able to block out time rather than me blocking out time for members of my team that maybe didn't need as much support. And then, especially for your leaders, make sure that you're not only asking those questions, but you're also listening to your team. When your teams tell you something that indicates that something is off, lean into that and be aware of when that happens. And so you can then more proactively approach any sort of stumbling blocks or brick walls that you might get into. So, symptoms to watch out for. Here's the easiest way that I can tell you that your team will tell you or display to you that they're having a rough time or that they need some extra support. It is when you say, hey, how are you, in the morning, and they say, oh, having a rough day. And that happens every single day for an extended period of time. For some staff, an extended period of time might be 3 days in a row. For some staff, they're always having a bad day. And so you have to look out for the times when they're having a worse day. So it's really about, again, back to this place of connection. If you have a connection with your team and you have a deep understanding of what makes them work, what makes them tick, how they listen, how they communicate with you, you'll be able to see those shifts in their approach to their day-to-day. So some main symptoms: feeling super tired or drained. Every day is a horrible, rough, awful day. This one, the third one, is one that I think we don't necessarily pay attention to enough in terms of how we communicate with each other. When you are doing your job simply because it's a job and there's nothing meaningful or impactful about it, it's generally speaking a sign to do something different with that, whether it's increased responsibility or decreased responsibility, whether it's shifting clients around. I helped to oversee the case management staff when I was at the nonprofit. And sometimes all our case managers needed was a swap. If they had a super, super heavy client that took a lot of time and it was really draining, sometimes having a second case manager come in to support them gave them the space that they needed in order to be able to better serve those members. Another symptom to watch out for is when everything feels like a total waste of your time and a total waste of your energy. When we stop caring about the things that we do and the things that we impact and the things that take up our time, that's an indication that what we're doing is too much. Whether it's too much time, too much brain space, too big of a task for us without sharing the responsibility. And then we'll then lead into withdrawal behaviors. So you'll have staff who are frequently calling in sick, staff who are saying, I just can't handle it anymore, staff who are saying, you know, I could use some help, but I just don't care. And if you have a trusting connection and an authentic relationship with your staff, they really can feel comfortable enough to come to you and say, look, I need some help. And then our responsibility as leaders and managers is to do something about that. Whether that's having a conversation about what they're currently doing that isn't as effective or efficient, or having a conversation about what needs to come off of their plate or things that need to be swapped out of their plate. Remember too, that it is our staff's responsibility and it is our responsibility as managers to be open to the feedback that we get. And so if we see things in our staff that are inefficient or ineffective and our staff becomes resistant to doing those sorts of changes, we have to figure out in our authentic relationship how to go around that and have a different conversation. So as you're looking for these symptoms and as you're trying to understand what to look for in your staff, look for those big ones: feeling super tired, showing up late, leaving early, frequently calling in sick, less caring about things, sloppy paperwork where paperwork was actually really clean and well put together 6 weeks ago. And then when you want to approach your staff, ask them the questions and be really honest about it. Try not to hide your question or dance around the topic. Try to have a really, really clear, authentic question that sounds like it's coming from you. For me, it's, hey, listen, I noticed X. I noticed your paperwork's looking a little bit sloppy. 6 weeks ago, we didn't have that issue. Can you share with me a little bit about what's going on? And then give that person time to be able to talk to you. And maybe they're going to get a little frustrated. Maybe they're going to get a little defensive. Maybe they're going to get a little, it wasn't really me, it's all of these other things. But allow them that time and share that space with them so that they can really focus on being able to say, I'm super overwhelmed because my kids are home, or I'm super overwhelmed because this client's constantly going into crisis, or I'm super overwhelmed because this client's constantly going to the hospital and the hospital expects me to show up every time they're there. So listen to what your people are telling you and try to take some small actionable steps so that it feels like you have more power and control over it. And then no presentation by Heather Pierucki would be complete without symptoms to watch for in ourselves and creating self-accountability. I'm huge on being honest with ourselves about the things that we struggle with. And so if I'm impatient, I can't expect my staff or my subcontractors or my collective partners in the system to not be impatient with me. If I feel like a failure, I'm not going to bring my best self to any sort of presentation, any sort of partnership meeting, any sort of brainstorming meeting. If I have self-doubt, I'm not going to feel confident in my ability to communicate effectively. If I'm avoiding tasks, it means I either don't want to do them or I'm not motivated or inspired by them. If I have decreased satisfaction in my work, it means I'm going to decrease the quality of my work. And we have to be honest with ourselves about when we get into that space. And then we have to take some sort of action to flip it, pivot, lean a different way. Because what will happen is you'll start to isolate from those things and you'll start to think, God, why don't I care about anything anymore? Why do I feel like I don't have balance? Why am I short with my team? Why am I short with my spouse? Why am I short with my kids? Why am I short with my coworkers? And so isolative behaviors are much more difficult to come back from than things like, wow, I am a little bit snarky today. I need to check in with myself. And so maybe instead of eating lunch at your desk at your house, you take the dog for a walk. Maybe instead of starting your day at 7 a.m. when the start time is 8 a.m., you take that hour to meditate, to write in a journal, to read a book for pleasure so that you can connect with yourself and help alleviate and address some of those symptoms that you feel. So I want to talk a little bit about stress versus burnout because they are different and they're very close to each other, but generally speaking, stress is what leads to burnout. You generally don't have burnout if you haven't had a period of stress first. And so when we talk about stress and we talk about how the obligations of our day-to-day impact us, stress demonstrates as things like being overreactionary. Everything feels super urgent. You can tend to get hyperactive about your obligations. You feel zero energy, but yet you feel like you have to do everything all at once. It can feel super, super heavy physically. You're over engaging with people, or you're much more defensive. That's how stress tends to manifest itself in our day-to-day. Burnout, on the other hand, is when it looks a lot more like a withdrawal. So you're going to have blunted emotions. You're going to have helplessness or hopelessness. You're going to have a loss of motivation, a loss of hope, a loss of feeling like what you're doing is impactful. Burnout is really a point that you get to where we have to take serious action in order to heal ourselves from where it is that we are. And so when you're looking for these things in yourself, try to understand, am I disengaged or am I overreacting to things? When you're looking at your team and your staff, is this something where people are overwhelmed and people are feeling like there's so much to do that they don't want to do anything? Are they walking around with their shoulders hunched over and trying to carry the weight of the world on top of them? That's stress. And what you need to do with that is call it to the table. Hey, listen, I noticed you've been having a lot on your plate. Talk to me about what you're responsible for so that we can brainstorm around it. I'm a huge fan of whiteboarding when you become stressed out. So if you put everything onto a piece of paper, everything onto a whiteboard, and you start to connect the things that you need to do, you can often find some relief in the amount of things that you're managing. When you get to the point of burnout, usually it's indicative that you need to do something different, where the amount of time that you've allowed stress to exist in your day-to-day is necessitating some sort of either extended time away, thus my week off next week, or you need to shift something in your amount of responsibilities that you have at work. And I want to encourage, for those of you that are high-level executives or C-suite, this applies to you as much as it applies to anyone else. If you are overly stressed and you are overly burnt out, continuing to push yourself past the point of extinction and to the brink of the cliff that you're going to fall off if you move one toe does your staff no good. And it creates a divide much more than it creates a connection. And so my encouragement to you, and if you hear nothing else from this entire presentation, my encouragement to you is talk to somebody about what to do about that. Because we need our leadership to be healthy. We need our leadership to be engaged. We need our leadership to have the time to have conversations rather than saying, I don't have time to talk to you about that right now. We need our people to be able to lead us in a way that we can model ourselves after. And so the responsibility of our C-suite and our executive leadership is probably double the amount of our mid-level managers, because we do trust you to be able to recognize it in yourself so that we can recognize it in ourselves and create a safe place to be able to say, look, my personal life is all over the place. I need a couple hours to take care of something, or I need a couple of days, or how do I find the right kind of coverage? And I recognize and I understand that this is something that's really difficult. The reason that we have webinars and conferences about how to take care of ourselves is because it isn't always simple. It's not easy, but it is something that if we don't pay attention to it, will lead very quickly to burnout. So what do I do? For those of you who know my style, I tend to be super holding space, but I won't let you get away with not coming up with one actionable plan. So if your only actionable plan is to take a super deep breath, then that is your only actionable plan. For the next week, every single morning when you wake up and you start to have all of that information flooding into your brain, your only responsibility is take a super deep breath and recognize that you can do this. Pull that breath all the way into your nose, all the way down into your diaphragm, and float your belly all the way out, almost to the point where you feel like you could not get one more tiny piece of air into your belly, even if you tried. You can do this, and you can tackle this particular barrier, brick wall thing that's getting in your way. And I think the very first challenge that I have for you, if you are ready after you take that super deep breath, is to recognize the difference between something that needs to be taken care of, something that's urgent, and something that's an emergency. When I work with my folks who deal with severe and persistent mental illness, the very first question that I ask them when they call me and they say, oh my God, I'm freaking out, is this urgent or is this an emergency? And it forces them to take a deep breath, recognize that they have a support system, and then we talk about, nope, that's not an urgent need. That's something that you can take care of tomorrow. That's something that you can do Friday. That's something that you can do next week. That's an appointment that you can reschedule. That's a conversation that you can have with your partner later today. And the only real emergency is, do I need to call 911 or do I need to go to the ER? That's really how you like dictate an emergency. Like, would you need to call 911 for this right now? Secondly to that, after you've taken your super deep breath and you've given yourself an opportunity to have a minute and pull that air all the way into your belly and expel that air all the way out through your nose, you've recognized that this is something that's urgent. Ask yourself, do I need to change something about my perspective? Do I need to take a break? Is the next step something that can wait 15 minutes? Is the next step something that can wait until I've calmed myself down? And then ask questions. Listen to what your people are telling you. Be present with them as they explain to you what the problem is. And then once you guys have hashed that out and had a discussion that maybe blurs the personal professional, maybe leans into the human connection as opposed to just the task management stuff, make a plan. And maybe that plan is every day when we come into work at 8 o'clock, if you guys are emergency workers and you're coming in on shift, maybe the only plan is to take a super deep breath every single day for 5 days, because it will allow you to do something differently than you've been doing. Maybe that's the start of making a different habit or discipline at work. So as leaders, it's our responsibility to implement these sorts of things and encourage our peers and our staff to be able to be open to those sorts of suggestions. And then it's our responsibility to be accountable to that plan. We cannot expect our people to do those things for us. Initially, when wellness sort of came into my schema or my aura, and I started thinking a lot about what I do to make myself well or create space to be well, I realized at work, we didn't do anything. Like we didn't have, I mean, it's a nonprofit and so budget is always an issue, but we didn't have like healthy snacks. We had the gas station next door, and I gotta tell you, I took that potato chip break more days than I didn't. So we didn't have the opportunity to go to the little gym space that was created in our office. We didn't have the opportunity to like take long extended lunch breaks, because a lot of times our clients would go into some sort of urgent need. And so what we did was every day at 3 o'clock, we implemented 10 minutes of stretching in the lobby. And any staff member that wanted to come and join us, we blasted it over the PA and we said, I know you have 5 minutes to take care of this and to enjoy this with us. We all met in the lobby, and then one person was responsible for implementing the stretches that day. And it really, especially at the end of the day, allowed us to be super present with each other, take a 10-minute break. And that was our plan. And it wasn't complicated. It didn't need to be anything other than it was. It was just something simple that we could do for each other. And lastly, my favorite thing to talk about in the entire world is connection. Connection really talks about several different relationships. You have your connection with yourself. Some people say it's with your psyche. Some people say it's with your soul. I think that our connection and our relationship with ourselves is the one that tends to heed the least honesty. And so in a connection with ourselves, and if we are really habitually and in a disciplined manner trying to create space in which we can listen to the needs of our body and our mind and our soul, we can open up the possibility for us to be a healthier human overall. And I think that connection with ourselves is the most important foundation that we can lay so that we can bring the best version of ourselves to the rest of the world. And a couple of ways that you can connect with yourself and other people are refusing to isolate. Don't put yourself in a box and shut all the lights off and pretend like everything's going to go away. Ask for help and be reasonable about the help that you're asking for. Your boss cannot take every responsibility off your plate. Your staff cannot do 10 times the things that they're doing now because they're already stressed out. So ask for help, be reasonable, avoid miscommunications with each other by being very clear about what you're asking for, and then share confidence with each other. Share the hope and the idealism that you have about, we can totally get 40 staff members in the lobby to stretch every single day at 3 p.m. I know it seems impossible, but we actually can do it. And I got to tell you, I don't think we ever had more than maybe 10 or 15 people. But the 10 or 15 people that showed up, and they were super, super present with each other. And they were positive, and we laughed about the music choices that people brought, because I didn't know you guys listen to that music on a regular basis. But, you know, we gave each other the opportunity to share things that sort of blurred the personal and professional and created connection. And we also shared our fears. I fear that if I step away from my desk for 3 minutes, I'm not going to get the work done that I need to, and then I'm going to be here late. So the more that you make and create time to be able to share wellness with each other, the more that those connections will influence things down the road too. Your connection with yourself and your sort of authentic honesty with yourself will help you be more authentic and honest with each other. And then I do believe that that will bleed into our coworkers, other staff, leadership, and hopefully, before I retire, our system. And our system will be a place where people can share the things that they're afraid of, and we can make plans for our community to be able to connect with each other in ways that we haven't been able to before. This is a picture of my little family, and my family is the number one thing that keeps me feeling well. The dogs are my excuse some days to take a break and get outside and enjoy the sunshine. But they're also my reminder that things don't need to be as serious as I take them sometimes. My husband's very good at reminding me that I take a lot of things seriously, and sometimes I can, you know, step back from that. But, you know, if nothing else, I really feel like if we connect with ourselves, if we start to connect with each other, and we start to focus on things like, my personal life is just as important as my work life, or my employees' holistic wellness and recognizing the achievements that they have in their personal lives are just as rich as the achievements that they have in their work life, we can create a space in which people can authentically bring themselves to it, and then participate in it, and then bleed into each other. And, you know, in all honesty, I fail at this some days, and some days I'm like, why do I have 10 appointments when I should only have 4? Some days I get to the end of my week and I'm like, I'm not supposed to really be craving a weekend anymore. I'm supposed to be creating better balance. It's an opportunity for me to say, okay, where did things go sideways? And what do I need to do about that? And how can I be more accountable to myself? And it forces me to look internally, and then ask for help, and ask for feedback, and then do something different, create a discipline that will shift into a different gear. So I hope this was helpful and educational for you guys. I'm super grateful that you included me in your day, and I hope that if you have any questions or anything, I'll be here at the end. But I hope that you are inspired, and I hope that this gave you an opportunity to sort of check yourself and participate in your relationship with yourself in a different way. So I'm gonna ask that the control be passed, and I'll see you guys at the end.
Heather, thank you so much for sharing a little bit about how we can help ourselves and how we can help our teammates. We do have some questions that have come in the question panel, and I'll reserve them for the end of the session, but I do want to give you a heads up that there are some questions that have come in from our viewers. And now I'd like to transition to Dr. Kozak. Dr. Kozak is an internal medicine doctor who practices at Straw Medical Center and has been doing that since 1999. She joined UHA as medical director in 2016, and in that role, Dr. Kozak assists UHA members with access to quality healthcare services, and works to ensure that these services are provided appropriately and consistently by working closely with UHA providers and their in-house registered nurse care specialists. She's an incredibly engaging speaker who has a knack for delivering information in a very, very understandable and oftentimes quite humorous format. Dr. Kozak, first of all, I want to thank you for being on the front lines as a healthcare provider and helping to keep our community safe as a physician. So thank you for that. We appreciate your work and we appreciate you spending some time with us today. So I'm going to hand the forum over to you now, Dr. Kozak.
Great, thank you so much. And thank you, Heather, for that fabulous discussion. One of the things I took from it is you have next week off, so you promised to watch this webinar again every single day, and I wrote that down. So you're on. The one thing, and it's kind of interesting, one of your slides said refuse to isolate. Please isolate if you have coronavirus. Just throwing that out there, that there is something we want to isolate from. We'll talk about that in just a few minutes. Let's head on to the slides. I'm lucky enough to have somebody run them for me, so my technology lack of savvy is not going to be a problem. So, as we start going on the slides, the first thing I'd like to do is mention that, years ago when I very first started in internal medicine, I had a wonderful mentor at the Mayo Clinic. In our very first rotation, we just come out of medical school. We don't really know exactly what we're doing yet. And he was a race car driver. He was like an 80-year-old guy. And I kept thinking to myself, well, if you're in your 80s, how fast did cars go when you were driving them? And, he actually brought in pictures. It was really sweet. He showed us these photos. Well, one of the things he said was that if you see a wreck, if you're going around a track and you see a wreck off to your right or to your left, he said, don't look at it. Don't look at it because you'll shift your head, you'll shift your body, and the next thing you know, you're going to be the next part of the wreck. And so I thought it kind of explained why I always find myself in potholes. I mean, there's a picture of a pothole. I probably drove in it. I'll look on the road. I'll be like, how deep is that? Boom, there I am. I'm in it. And so one of the things he talked about was keep your eyes where you want to go. Keep them in the direction or the location of where you want. I remember the first time I tried to drive through a toll booth. I swore my car was not going to fit through a toll booth. And of course, every other person's car does. This is on the East Coast where we actually have these skinny little toll booth lanes. And I remember thinking, if I just keep my eyes on where I want to go, I'm probably not going to hit the side. And I was in a big car, so it was kind of hard. But I got through it and I went, okay, so the idea is to keep your eyes where you want to focus, where you want to head towards. And that gets to the idea of something I call paranoid versus pronoid. Now, we've all probably heard of the term paranoid when you swear everyone is out to get you. And one of the lesser known terms is pronoid. And it is a word, I didn't make it up. It's when you actually feel like the world is out to conspire to help you. So when we think about some of the difficulties that have occurred due to coronavirus, and certainly not to in any way dismiss the horror that it has caused for a lot of people throughout the world. And there's a lot of suffering that is going on. Pronoid is to take a look at it from the perspective of what could we learn from this? What could this pandemic be teaching us? Is there something that we can take that is just a tiny bit positive so that we can focus ourselves on that? When you think about pronoid, you think about the world. There were some satellite images of climate and the different types of pollution in the air. When the pandemic first started, you could see that there were areas over China where there were clear skies. India saw blue skies. These are things that people didn't normally have an opportunity to see. It was because some of these countries were on lockdown to try and reduce their exposure to coronavirus. And we saw some healing of the environment. I've heard, although none of us can tell, that Hanauma Bay has crystal clear waters. It's closed. So there's a lot of effects that we've had on the world that might be changed as a result of this. The other way to look at pronoid is what's happening in your community. And I've seen some amazing things. Some restaurants that have delivered food to the hospitals for all of the first responders, to seeing that there are some groups where the elderly are being serviced by neighbors. There's a new platform, Next Door Neighbor, and it's sharing where people are actually helping their neighbor to get groceries and do all these sorts of things. And then personally, internal medicine, we've suddenly lost our fear of telemedicine, and we've had to become more adaptable to patients and bring to them the healthcare that they need in ways we never did before. So there are some positives that have come from this. And again, not to limit the negatives, but keeping our eyes on where we want to go, instead of feeling like every time you turn on the news or you watch something or hear it on the radio, it's always like falling in the pothole, the one area you don't kind of want to get to on a road. If we can go to the next slide. It's not always possible to do this. Empathy is something we all really need for one another. Empathy is defined as the action of understanding, being aware of, being sensitive to the feelings and thoughts and experiences of others without having to explicitly communicate those. Things that you can do. Now, Heather, I know you're a dog person. I'm a cat person. These are not my cats, but they're very cute. Kind of want to pet them. But there are sometimes when we can just share a little bit of compassion for those people. They may be having a very difficult time. There's a lot of parents who are dealing with kids in school and exposure, and some of them are in that sandwich generation, taking care of their parents. People are scared and concerned. And so even just demonstrating some of that on a level in a workplace and just letting people know that you get it, you understand. And there are some ways that you can communicate this. And Heather talked about a lot of those, encouraging people, doing the text message with the people in your group that you're managing. I think it's a great idea. Sending funny little tidbits of something that might have happened that's kind of funny. I heard this joke the other day, the worst purchase of 2019. And that's a 2020 planner, because nothing we've done has actually gone as planned. So when we think about things that we could do to help one another, it's just reaching out in some ways and expressing those thoughts of concern about folks. If we can go to the next slide. There's this game that I remember, and now I'm dating myself because Kevin Bacon was sort of young when I was doing that, and it was 6 degrees of separation from Kevin Bacon. It was the idea that we're all connected, even when we think that we're not. And if you look at the very early, one of the websites I've been watching, and I have to stop because I've gotten a little obsessive about it, is called Worldometer, and it lists the number of coronavirus cases. And very down, if you scroll down to the United States, it describes back in late January when we had like 1 case. If you ever think one person can't change the world, you look now that there's over 20 million cases. One person can make a huge difference, and we can all make that difference for one another. One of the things that has happened during this whole pandemic is a true recognition that we're all connected, even when we're apart. We're physically all connected in some way. It's not 6 degrees of Kevin Bacon, although it's a fun game if you've ever played it and you remember movies from the 80s, because again, I'm dating myself. But we're all connected. There's very little separation. What happens in China, what happens in India, what happens in New York affects us here in Hawaii. In fact, New York just decided that people from Hawaii should quarantine because we've got some coronavirus spread. So it's kind of ironic when that was sort of the epicenter just a few months ago. But just recognizing that what we do has a direct impact on a lot of other people around us. And how can we manage that? And how can we make sure that what we do creates a positive change? Another thing for us to take a look at. If we can go to the next slide. Be aware of self-care. Heather, you brought some great ideas of self-care. Getting up early to exercise, or finding time to walk around later in the afternoon, or finding a group of people that you can even just virtually walk with. I'm going to go for a walk this many miles on Monday. You do it on Monday, and then we'll text each other later and make sure that we're accountable. It's much harder to do that on your own, but having a little group that you can network with while still being distanced is one of the ways that we can definitely help support one another. Most importantly, know your own limits, because your limits are very important, because you won't be able to help other people without knowing how you can help yourself. There's always that picture they show anytime you go on an airplane ride of the oxygen masks, and you hope it never actually pops down out of the ceiling, but you're always told if it does, put on yours first before you help anyone else around you, whether it be children or adults or anyone else. Part of that is because if you don't have any oxygen yourself, you're not going to be able to help other people. So knowing your limits and working on your own self-care, doing some of the deep breathing Heather talked about. That's a very simple thing to do every day and something all of us have the capacity to do. And really just recognizing that being a hero is exhausting. You can't do it all the time. Even the first responders, the people that are out there in the emergency rooms, in the ambulances, firefighters, the police, all those folks that are out there, they're the ones that really are coming directly to the scene where there's an emergency. It's really difficult. You can't do it 24/7. So setting up some time where you can step away from that is always helpful for your own mental health. It's like putting on your own oxygen mask. Also consider coworkers cooperate. So making sure that coworkers are in a situation where they're cooperating with one another is helpful. And you talked about it earlier, Heather, helping clients, and you're working with one and somebody else might need some help, and having two people work together this is a time when that cooperative effort, even if it's just providing some kind of support, or I'll bring in lunch for everybody today, and that way nobody has to leave to go somewhere to get lunch. Something simple that will allow people to help one another, but also feel good about the fact that they're doing something that are helping their colleagues. That's always something that I think is a great opportunity to share what we can do just to support one another and make our jobs and our lives just that little bit easier. At Straub in the cafeteria, when they first started to have the pandemic, they went out and bought a lot of supplies because a lot of people who were working in the hospital, the nurses at night, some of the other physicians, they couldn't go out and get things. They didn't have time to go food shopping or do things like that. So they created this own little shopping corner. So if you needed to get that golden thing of toilet paper, that was a big hit. But if you needed to get rice or other essentials, you could get it from where your work is. You could purchase it from the cafeteria, and that would eliminate one other place you'd have to go on your way home. Just another way that we can think creatively out of the box to help one another. If we can go to the next slide. Then we think about reaching out, but not necessarily touching. Telemedicine has been another way that the medical community has really responded. There was a study that came out recently. CMS, which is the Center for Medicare and Medicaid, they looked at in Hawaii the statistics from February of this year. The number of visits that took place in telemedicine were 0.1% out of the 62,000 visits. They did an analysis looking in April. Again, these are Hawaii specific statistics, but it is looking at Medicare visits, not necessarily other types of visits. Already 38.3%. Now, the total was fewer because people were told to stay home, but telemedicine is a way that physicians have been able to reach out. You can't touch a patient, but certainly you can reach out. And that's that Neil Diamond song of Sweet Caroline, which I know you're all singing in your heads right now. Unfortunately, you can't reach out and touch other people sometimes, but there are some ways that medicine can help. And we'll talk in just a moment about some unique things that have happened. Next slide. The visits of the future. Take a look. You're going to be talking to your doctor on the phone, doing video visits. This has been a real interesting change that has happened and occurred over time. And these are ways that telemedicine has helped to provide continual health care for people while not necessarily having them go to crowded waiting rooms or go to places where they might get exposed. Our next slide. I had a real interesting review. There's Telemental Health care. This is an effective alternative to conventional mental health care. But if you look at the date on when this article came out, it was 2017. So we really had been kind of slacking a bit in our adoption of telemedicine, but studies had already shown it was really effective, particularly for areas where a physical exam may not be necessary. So one of the ways that we can incorporate telemedicine is to look at doing this in the environment with people who are mental health providers. Go into our next slide. If we look at where this is most effective, therapists, psychologists, psychiatrists. I had a patient of mine who actually decided that she was going to start going to AA meetings around the world. And she figured out, now she's in her 70s, so she made me look really bad technology-wise because someone else is running my slides because I couldn't figure it out. So, she's in her 70s. She figured out how to Zoom call internationally for free. And she figured out a way that she could join AA meetings, English speaking, all around the globe, because that was something that she felt strongly about and she wanted to continue to participate. So this has really helped with a lot of folks who need some help, who want it to be confidential, who don't want to have to go to an office, who don't want to see other people in a waiting room. There are some readily available services that'll connect you to therapists just through your phone, through some sort of telephone portal. It's confidential, it's accessible, and I really think telemedicine is where we're going to solve some of the shortages, some of our neighbor islands, but also even across the US. If we have shortages, we'll be able to fill it with these types of novel services, and they're very effective. And the study from 2017 we shared earlier on the slide proves that they're effective. So we know that these are things we can do. Next slide. Last but not least, I wanted to remind people that, Maya Angelou, we lost her a couple of years ago, but she had a really well-known quote that said, at the end of the day, people won't necessarily remember what you said or what you did. They will remember how you made them feel. And for any employers who have the opportunity to make their employees feel valued, secure, understood, and just cared for, that's what they're going to remember the most. Even if their jobs are not there in 6 months because things continue to get worse in this time of the pandemic, they will remember how their bosses and how their managers made them feel. And that's something that I see even in my medical office all the time. Patients sometimes know that I can't cure whatever their ailment is, but I listen to them and I make them feel heard, and I provide as much empathy as I possibly can to their situation. And sometimes that's all I can do, and that makes all the difference. So for those people who do want to look at some of the mental health services, I'm sure we can get a list of those providers who are providing those services either through phone or through video, ways that people can be physically distanced, but not necessarily socially distanced. We need to reach out to one another now of all times and help support each other through this entire process. They didn't call it a novel coronavirus because we knew what to do. It's because this is brand new and we're all just trying to figure it out as we go along. And having compassion for those people in all different levels of leadership, of employment, of even the people who are janitors who help clean bathrooms. Just having that empathy for them to understand that everyone's scared. And there are those of us who can help those who are exhibiting that fear. And by making sure that we address the fears ourselves within ourselves, it'll put us in a better position to help them. And that's all I've got.
Thank you so much, Dr. Kozak. I think that list would be really helpful of those practitioners that are available for telemedicine for mental health. So hopefully that can be included as part of the resources that's emailed out at the conclusion of this webinar.
I'll work on it.
Mike, next up is Mike Story, and Mike is a workplace wellness consultant at Hawaii Health at Work Alliance. And Hawaii Health at Work Alliance's goal is to help you create a holistic culture of well-being that supports emotional and mental health. So Mike, what he does is he helps companies develop customized, sustainable plans that will help their employees improve their wellness through healthier diet, fitness, and work-life balance. Prior to joining Hawaii Health at Work Alliance, Mike owned and operated his own company, GS Events, an event consulting and management company. And right now, in his own lifestyle, Mike not only helps companies help their employees become healthier, but he actually lives a really healthy lifestyle. Back when COVID-19 didn't require shutdown of the pools, he used to volunteer for swimming meets and devoted a bunch of time to the Oahu Water Polo Club. So Mike, I'm really excited to learn about mental wellness best practices that are actionable and effective and easy for us employers to implement. I'll turn the forum over to you now, Mike.
Great, thank you so much. I really appreciate it, Sherry. And aloha, everyone. Thank you for, let me show my screen. Before I get started, there's two things I would like to do. Number one, I need to acknowledge the fact that today's workplace has so many different settings. But the good news is the information I'm going to provide today is for a workforce that's in the office, at home, or wherever they may be to do their work. The second thing I'd like to do is introduce Hawaii Health at Work Alliance to those who may not know who we are. We're a UHA company, and we support UHA's belief that employers are uniquely positioned to help employees achieve a healthy lifestyle. And we're here to support organizations that want to implement wellness programs with this goal in mind. My presentation today has three different sections to it. The first, I'm going to provide some data on the bottom line impact mental health has on business. The second, I'm going to share 6 steps that you can implement for a mental wellness program. And the third is to provide a hub of resources that I'm going to direct you to help you with that implementation. All right, so let's get started. So your employees are your organization's most valuable asset. An investment in their mental health is essential to their health and to the overall health of your business. The human impact is huge, and there's also a bottom line impact to the business. The National Health Alliance estimates that employers incur $100 billion in mental health related costs each year, with 217 million lost workdays. Mental health also has a ripple effect. and directly correlates to physical conditions, such as heart disease, diabetes, substance abuse, just to name a few. The cost to treat those with both mental health disorders and the chronic diseases is 2 to 3 times higher than those without these conditions. But that's the bad news. The good news is that investing in mental health pays off. The World Health Organization estimates that for every dollar spent on treating common mental health conditions, companies see a $4 return and improved productivity. So treatment works. The American Psychiatric Association reports that 80% of those who are treated report improved satisfaction and efficiency. So the bottom line is businesses benefit and employees benefit. But the reality is employees want more support from their employers. In a survey conducted by workplace consultant Peldon Rose, nearly 75% of office workers say they'd like employers to champion mental health and well-being in the workplace. So over the next few minutes, I'm going to share with you 6 steps to implement a mental wellness program in your workplace, again, wherever your employees may be. Step 1, educate. Mental health is still too often surrounded by stigma. Yeah, we can educate our employees on what mental health is, what it isn't, and how they can help make a difference. I came to UHA for a number of reasons, but one of the big reasons was their benefits, including their wellness culture. This photo is of UHA's Wellness Center. When I first started here, I was located on the 4th floor. The reason being is on the third floor was being remodeled. But over the course of 2 weeks, I ran into a number of coworkers who always encouraged me to go exercise and work out in the wellness room. I never did that, and I didn't quite understand why, because I'm a very healthy person. I like to exercise. I'm very active, but I never went to exercise in the wellness center. Well, fast forward 2 to 3 weeks, the 3rd floor was done being remodeled. We moved down to the 3rd floor, and my desk happened to be set up really close to UHA's CEO, Howard Lee. And one day I was working and I heard Howard say to another executive, "Yeah, we're going to need to meet about that, but can you give me about an hour?" And Howard walked into his office. About 3 minutes later, he walks out, and our CEO is dressed in a t-shirt, shorts, and running shoes. And I watch Howard go to the wellness center to exercise during the day. That step alone gave me permission to do the exact same thing. And so I started to do that. So the idea is that leaders must lead. Leader has to participate in whatever you're doing. So get your executives to speak up, to create an environment where employees feel free to talk about their challenges and their struggles. Have the CEO or another executive be an open, vulnerable role model. Can you imagine a scenario where your leader would share his or her own mental health challenge, whether it's anxiety, depression, maybe even a past life of substance abuse? Now imagine the impact that that might have on others in the organization, especially those suffering with the exact same issues, but maybe too embarrassed or ashamed to speak up. But seeing and listening to the leader share their personal struggle, they may embrace transparency and come forward to seek help. And this is really the start of creating a safe place, a safe work culture. So my personal example of watching UHA CEO go exercise let me know that it was safe to mirror his actions. Step 3 is connect. Yep, face-to-face. Coworkers need to get to know one another. We should really be able to understand our coworkers' personal environment, right? We all need peace, economic security, a stable ecosystem, safe housing. Do you know if your coworkers have those things? We also need to understand a coworker's physical resources, right? Everybody needs to be physically active, have a nutritious diet, be socially connected, have autonomy. Do you know if your coworkers have those things? So we should really be aware, because this creates a culture where employees feel safe to share their feelings and talk about their personal issues at work. I have a really good example of what we did at UHA. It's called the Gratitude Challenge. It's basically a journaling initiative what it was internally, we broke apart into groups of 3 or 4, and every day we would spend some time journaling on our own. But the one rule was we had to come back to the group once a week and share what we journaled. Well, this process has created connections, it created understanding among coworkers, and created a safety net, if you will, a safe place where people could go. And if you're asking, yes, our CEO and our executives did participate in the challenge. If you want to learn more about that journaling initiative, give our office a call. We would love to share more detail, provide you what we experienced. And if you want to do one of your own, we'd love to help you. So step 4 is resources. There's never enough resources that you can provide to your employees. If you don't have one now, I would highly encourage you to look into an employee assistance program. This gives employees access to free and confidential assessments, counseling, and referrals. But if you can, don't stop there. A lot of times organizations think an EAP program is sufficient, but it's not. We're learning that truly a successful mental wellness program has so many more layers to it and so much more texture that needs to be included. So step 5, create balance. So keep an eye on the hours you're asking your employees to work. Well, common sense might tell you that employees who work longer hours are contributing positively to the business. Research tells us otherwise. We had Brad Stolberg at one of our past events. Brad authored a book about avoiding burnout. You can see the face. It's called Peak Performance here on the slide. And we actually hope to incorporate Brad into a future webinar that we're going to have. The last step is measure. Your organization probably measures sales performance, maybe conversion rates or customer retention, but do you measure mental health? If not, I'd like to direct you at the end of this presentation to a great article that gives a concise explanation on the type of questions to ask, how to score those questions, and then how to interpret those scores so you can manage, so you can measure. So what's the takeaway? Well, ultimately the takeaway is health is wealth for the employee and the employer. But let's just go over these 6 steps really quick. 1, educate and break the stigma. Help employees recognize and identify these health issues. 2, to have the best chance for success, leaders need to participate. 3, talking to someone you trust is really important. 4, invest in resources so employees understand where they can go for help. Step 5, understand the time employees are giving to their work and the stress that they're under to perform. Step 6 is measure. So 6 steps may seem like a lot to implement in the immediate short term. If it is, what I'd like to do from these 6 steps, I can extrapolate 3 key areas that I would like you to focus in the short term, obviously in the hopes that you build to these 6 steps in the mid to longer term. But the 3 steps are an acronym. ICU. Identify means educate coworkers on what to look for. Connect. Coworkers need to be able to connect with each other and those that need help. Understand. Employees need to know where to direct those in need. They must understand the outlet that can help their coworker. This 3-step system was actually developed by DuPont. It can also be found on HHAWA's website. There are a number of employee education tools and resources that organizations can leverage, ranging from free and basic to more robust fee-based programs. You can find these located on our Hub for a Healthy Lifestyle. You see the URL in blue above. But look, sometimes it's really hard to remember details of a presentation. So if you're struggling to remember anything I've said at all, I highly encourage you to reach out to Hawaii Health at Work Alliance at our 532-2156. Or please just call me directly on my direct line at 522-5572. All right, thanks everybody. Be well and stay safe.
Mike, thank you so much for that presentation. You know, if somebody wanted to reach you, but they're not a UHA member, or they're not a UHA client, can they still work with you?
Absolutely. We work with anybody within the community. Doesn't matter what carrier you have. We encourage everybody to call us.
Thank you so much. We have one question that came in for you, Mike, as you were doing your presentation. And this person asked, do you have any suggestions for a non-office environment?
Everything that I mentioned, you can do when you're not in your office. The journal challenge, for example, that we did, we weren't in the office. That actually happened after COVID hit and everybody was at home. So everything can be done online, just like we're doing these webinars now. We're not collected together in a room as a group. We're online and we're learning through these video calls. So anything can be done without being in the work environment. And if you want more information on that, please give us a call and we can explain more.
Thanks, Mike. You know, all of you, the three of you, Mike, Dr. Kozak, and Heather, all three of you, somewhere in your presentations have mentioned the importance of connection with each other, connection with yourself. And, you know, one of our viewers has asked, you know, when they're trying to check in and connect with staff, do you have any meaningful sets of questions or suggestions that might help to promote an engaged meeting with their employees?
I got an idea.
Sure.
One of the things
Yeah.
that I often suggest is if somebody says, how are you doing? The answer is probably fine. You know, maybe there's not much more beyond that, but then kind of setting them up in this mindset of what's going really well for you today. It sort of sets the brain to think, I have got to come up with an answer, and it's something going well. You can also say, and what's really challenging that I can help you with. It's a little bit deeper than saying, how's it going? Because that's a wonderful thing to say, but sometimes it doesn't lead to a little bit more of a engagement and an interaction. So I like to ask people, you know, what's going well today, to sort of have them focus a little bit on that positive aspect. And then what can I do to help you? Which is, again, something I'm doing to try and help someone. I may not be able to do anything or listen or just have them tell me, but it leads to a little bit more of an answer than, oh, I'm doing great, see ya.
That's a good tip, even as a parent. Yeah.
I think too, those are my two favorite questions, Dr. Kozak. So clearly you and I live on the same exact plane. What's going well and what's really challenging? I also like the question, what are you avoiding? I'm a little bit self-centered about that because that's usually the self-check question that I have. Like if I'm avoiding putting a PowerPoint together, it's probably because I dislike PowerPoint. But the content of the PowerPoint is what's important, right? So how do I make myself shine on the PowerPoint, even though I have to put it together, because it gives people something to look at. So like, what are you avoiding? And then the other thing too, that helps people find something really specific in a workplace setting, whether remote or in person, is if you could take one thing off your plate, what would you take off your plate? And it helps to identify those things where people get stuck. And it also opens up the conversation because you're using something very logistical to be able to have a bigger conversation.
Mike, do you have anything to add to that conversation there?
One thing I would say is that when you ask the question and the person you're talking to gives a response, you don't always have to provide a solution. Sometimes they just want you to listen.
That's a good point. You know, Heather, when you were talking about stress versus burnout, one of the questions that somebody had written in at the time is, you know, where can we seek external help with that burnout?
The number one thing that speaks to connection is having a place where you can go and ask that question, right? So in a workplace setting, I do like to start with EAPs. Mike, thank you for highlighting that. If EAP is not something that you mesh with, or you meet with somebody and it's not a good connection, always go to your health insurance plan. I have kind of beta tested a few of them to see how easy it is to get connected to care. And most of the customer service departments are super, super efficient at getting you connected to what you might need. The other is to talk to other leaders, managers, peers in your workplace, in your friendship group, in your community. You mentioned, Dr. Kozak, the international AA meetings, which a lot of my clients have been joining, because you just hop on and you get to see all these other people's approach to like how they hold meetings. Talk to people in your community, your church. I am an Orange Theory fanatic, so talk to folks at your place of like exercise wellness. If you start the conversation, most people will know or have a suggestion towards what direction to go to. But in a workplace, you can always start with EAP or connecting with your health insurance plan.
Thank you so much. There are no other questions that have come in from our viewers at this time, other than if they could get that list of mental health care providers, which we will try to send along with the resources at the conclusion of this webinar. And they wanted to express some thank you for your humor and all of the materials and tips that you provided during this particular webinar. Are there any final thoughts you want to leave us with and to summarize, or little next steps that we can do today and maybe even tomorrow for ourselves and for the people that we work with?
I'll start, just because I found myself in a pothole, and the pothole was the list. So I did Google while I was sitting here, and I went, oh no, what did I do? And we do have some website links that they list psychologists and psychiatrists and mental health professionals here in the islands, and phone numbers, what insurance they accept. Some of them list whether or not they do telemed, some of them do not. So this is just coming from the Hawaii Psychologists Association and a couple of other websites. So I'll make sure to get those to you, Sherry, so you can share those with everybody. Because as I said it, I went, God, that's such a great idea. Do I have that? And then, oh, there I am looking at what I'm trying to, there's the pothole, boom, I'm in it. But I do think that it's really helpful for people to think about ways in which they can communicate. And everybody, there used to be a big stigma about having a therapist or having a psychologist. There's a whole new profession, life coaching, that's sort of similar to some of that, certainly not the same. And there's a lot more credentials that therapists and psychologists have, but just finding a source for you to get some additional assistance in your everyday life often can help propel you not to where you were before the pandemic. None of us may get to where we were before the pandemic, whether financially or job-wise or whatever it may be, but to recognize your new normal and to figure out how you're going to operate in that new normal environment and situation. And that's going to be the one thing that the people who do well with this are those that are going to find that resilience and flexibility and find ways to, surf the big wave. Because if you're on a wave, and I'm not a surfer, so people have told me this, and if this is wrong, I'm wrong. It's very possible. But if you're on a board and you're trying to catch a wave, you got to sort of loosen up. If you become really stiff and you lock your knees and you flex your arms and you lock your elbows, you're not going to be able to respond to the wave and where it's taking you. But if you sort of adopt this stance of resilience, of flexibility, of I'm just going to try and balance, and I might need to put a little bit more weight on this leg or that leg and not lock my knees and keep myself ready, that type of mental attitude is going to help. In a wave situation, it helps you to ride the wave and get a great ride and enjoy it and have the time of your life. In a personal situation, it helps you to recognize that there are certain things we need to be flexible about. We can't be so rigid, follow certain schedules, make everything go exactly the way it used to. We have to adopt this more resilient stance. That's how we're going to make sure that we don't, get pounded by the waves. So finding people who can help you to discover that is always valuable, no matter what. It doesn't matter what circumstances it is, whether it be psychiatrist or therapist or psychologist or social worker or whoever it is that is going to help you to find that new balance for you is going to be dramatically helpful for not just during the pandemic, but for the rest of your life.
Thank you, Dr. Heather?
I just said preach, and I already can't wait to hear Dr. Kozak speak again. Like, I'm already excited for whatever you do next. So please email me and let me know, because I could listen to you all day.
You're on vacation next week. Yes, you can.
Right, not then. Well, actually, I'm going to watch this recording
to
watch you again. It's fine. So there's a couple additional questions I think that popped through, so we can answer them outside of this particular presentation. One of them is about low cost care, which I'm happy to help with, Sherry. But my final thought is that we just really have to shift. Like, we cannot do things the same way that we were doing them a year ago. I can't work the same way that I was working a year ago. Mike, Sherry, Dr. Kozak, like, none of us can do things the same way that we were doing them last year. We have to be able to be a little bit fluid. And when we think about our healthcare workers and our crisis workers and the people who show up every single time there's an emergency, there has to be a shift for them as well. Yes, crisis is going to keep happening. Yes, there's going to be emergencies. Yes, we have things set up to be able to take care of that. But we as workers also have to shift too. We do need to prioritize our own mental health care. We do need to prioritize our own physical wellness. That may not be running a marathon in the middle of a pandemic, but it might be getting out and getting some extra sunshine, or getting out and taking a few laps in the ocean. It could be something as simple as just getting out and breathing the air for 5 minutes. We have got to take responsibility and accountability for ourselves as well. We cannot expect that others are going to do it for us. And for those of you asking questions about leadership, it is leadership's responsibility to lead by example. I love how Mike emphasized that in his presentation. It is our responsibility as the leadership in our community to be able to model the shift and the fluidity. So 1, we cannot do things the same way that we've always been doing them. 2, we have to be able to shift and pivot and lean in a different direction. And 3, we're going to do that by connecting with each other and having honest conversations about what we need to do.
No, thank you.
I'd like to springboard off what Heather was saying. It's been really exciting to see somebody like Michelle Obama to come out and start talking about her depression. And it's really good to see Michael Phelps, this gold medal winner at the Olympics, talk about his depression. So the takeaway for me would be that don't think you're alone. Everybody is going through something. There's a lot of people to lean on, and there's a path forward. If you do feel isolated, even if you're at your home, if you want to even pull up on your phone and watch these on YouTube, people will talk about their issues and what they're struggling with. World leaders will be able to talk about it as well. So there's a lot to watch and to understand where you can fall back, and that there is support there to help you.
So if I'm somebody that I don't have health insurance, or if I don't have a lot of money, are there resources that I can use, or where can I turn to if I'm in that situation? And
that was actually the question I was talking about. And it's a longer explanation than sort of a Q&A opportunity. There's several options that you can utilize when you are income stricken. So I can definitely send those to you, and we can follow up with the folks that asked that question
okay,
after the webinar's over.
Okay, that'll be awesome. Thank you so much. And sure. Another question has come in regarding there's just been a lot more absences. Maybe people are testing positive for COVID, or maybe they're being asked to quarantine because a household member has tested positive for quarantine for COVID-19. And there's childcare issues, as my child, for instance, has to do virtual learning at home. And do you have any recommendations on keeping employees engaged and motivated above and beyond what you've already discussed today?
Well, one of the things that, Mike, you mentioned earlier about the gratitude challenge. And so we did that in the healthcare services department here at UHA. But people really enjoyed having that opportunity to just get together virtually, because it was usually on Skype or on the phone or on Teams, and just hear about other people's lives. We had like a question, 2 truths and a lie, which one of these is not about me kind of thing. The group actually decided to keep doing it. So separate from usual work time, they just have an opportunity where everybody gets together on one of those platforms and says, hey, we have a stimulating question. Everybody answer it, and it's more engaging and has people guess something. Do you happen to know when was it when I first, or what was my first movie I ever saw, or something that allows for that creative interaction that will generate questions that are so easy and personalized to answer that nobody feels like they have to know the answer, because they're embarrassed to to reveal something otherwise, and just something pretty simple that can help keep a team engaged even beyond the scheduled work time. Just a quick little check-in. And I love the idea you had, Heather, about the texting, because I get text messages all the time and they take a few minutes. So for somebody to go ahead and post something silly or funny, or just something about themselves or something that's going well with them, that doesn't even require that anybody set up a specific meeting. Just keeping that connection. A lot of us have smartphones. Mine, I think, is smarter than me. And I'm trying to put it down. I've been really getting addicted. I'm trying to put it down. It's right next to me. I'm touching it. It's like I can't help myself. But it's a great way for people to keep in touch. Again, I wish they would have called it physical distancing instead of social distancing, because we want people to keep a physical distance to avoid the spread of the virus. But that does not mean we want them to socially not interact and engage. So finding unique platforms, whether it be through My Buddy the phone or through Teams or Skype or Zoom or GoToWebinar, just having your team have an opportunity, check in if you want to, pick a time that's not a work time, and everybody share something pretty interesting or fun, or something that is about them or about other people that does not make anyone feel embarrassed or potentially revealing something they don't want to. Just something fun about themselves. I told everybody that in one of my former lives, I either got parking tickets or went to summer school or used to do tiny triathlons, and nobody guessed the triathlon was the truth, because my only goal was not to be last, and I didn't always achieve that. But it was kind of fun just for people to get to know something different about you that they never would have expected. I have not gotten a speeding ticket. I do deserve one, but I didn't get one. So, something fun that's just interactive, and that's one way to keep in touch with your team.
Yeah, and find those different platforms. A lot of the times you may feel like you're pulling your team to that platform, but that's okay. Pull them.
Thank you so much. Hey, Heather, Dr. Kozak, and Mike, we appreciate you spending your time, carving out a little bit of your day and spending it with us. To everyone who joined us online, thank you for attending our program today. When this event ends, you'll see a survey from GoToWebinar. And if you can take a moment to complete that survey, it would be much appreciated, as your feedback helps us to learn how we can help you and the community at large. The handouts and recording of the presentation, along with the helpful resources that were mentioned, will be sent to you via email. And on behalf of UHA Health Insurance, Hawaii Health at Work Alliance, Hawaii Employers Council, and Hawaii Business Magazine, we thank you for joining us today. We plan to present more webinars to help you cultivate compassionate leadership and connections within your team. So be on the lookout for more opportunities to learn. We hope to see you again at one of these events. And until then, please take care and stay safe. Aloha. Bye.
Aloha.